So this started, of course, gosh, was it March 24th, Tuesday? He woke up around 4 a.m. with a fever. So that's what kind of started this cascade of events. But I want to take you kind of before then what we did. So of course, the previous week, knowing everything was kind of getting hot in Jersey and in the Northeast. And so with him going to work, we have our 2 kids here on Earth, obviously, Vienna in heaven, and concerned for getting infected, right? So because being a carrier, you can be asymptomatic and have the COVID virus, be positive for that. So what we did was the previous week before he developed symptoms, he slept in our guest bedroom, which actually worked out perfectly. So he would come in through the garage, keep his shoes in the garage, take off his scrubs, put them directly in the washer, which is right around the corner. So actually the way our house is right now, it's a perfect setup for this, for like a pre-quarantine already. He'd wash his clothes immediately in hot water. And then I would be okay I would touch them, but I would wash them, wash my hands afterwards. So he did his own laundry. He would stay in that room, but at that point we had no contact, we weren't even wearing any masks at that time. I mean, he wasn't infected. So we thought, right. So, but he worked that Wednesday, Thursday, and the following Sunday. And then he developed the symptoms Tuesday morning. So, but as we're finding out now, there's always new information that before the person is symptomatic, you can transfer the virus 5 days prior. Wow. So if we didn't already have that pre-quarantine, I can guarantee the kids and I would have been infected. So
I'll say it.
Right. So that definitely worked out in our favor just because the way our house is set up, which is such a godsend, really. So then he developed those symptoms then, so Tuesday morning, fever, he texted me, I was sleeping with the kids, and I'm like, oh, bleep, you know what I mean? Of course, because that's what we didn't want to happen. And then, of course, the symptoms then continued from there where, fever initially with the cough, everything, of course, mild initially, and then slowly ramped up. Fever the first couple of days, and then afebrile for a couple of days, and then fever again, and then kind of back and forth with that, him continually to feel worse, even though we were doing as much as we possibly could, to treat him with everything that we were reading about that could possibly help. And then really, then it was that day 12, where every day I'm saying to him, I said, all right, well, you're the ER doc here. You tell me when you feel you need to go to the hospital because,
Let's back up a minute. The reason is trying to self-treat at home, both of you being physicians, is firsthand how overwhelmed the hospitals are. He didn't want to take resources away from anybody else.
That's right. That's right. Yeah. Because we know that the craziness that's happening in the hospitals right now with having friends, nurses and doctors, still on the front lines now, obviously, but yeah, that's exactly what was it. He's like, well, what are they going to really do for me? You know what I mean? At this point. So that's why we're trying to do as much as we could to keep him out, because we knew there were way sicker patients there than he was at that time, and with everything running out and shortages of everything, like we said, that's not what we want to do. And I even mentioned, well, is it going to come to a certain point where I need to call an ambulance, And he's like, no. He's like, just drive me down wherever I need to go. Like, so he didn't want to take an ambulance away from anybody else. So yeah, I mean, yeah.
But it did reach a point where he knew he had to go to the hospital, right?
Absolutely. It was that Saturday. It was the day 12. It was the 4th, April 4th. And, with the kids and I being cooped up, because I'm always kind of at the ready, to help him, whatever he needs. And so we decided to take a little hike, like, exploring through our backyard. There's a little stream and stuff. So we're back there. And I started to get the text from him saying, you know what, my chest is more constricted. I'm really having a hard time breathing, because his nights were already horrible to begin with, where the nights were always worse in terms of breathing. He couldn't really catch his breath very well every night, but the days were better. But then, of course, as symptoms progressed and symptoms got worse, he said, gosh, my chest is really tight. I said, he's like, well, I may need to go on a vent. I said, well, if this saves your life, I said, we got to do what we have to do, and so we talked about through text, because at this point he was kind of winded, to even talk. And so, I mean, the kids obviously and I, we were just in our backyard anyways. We came right in and, said, all right, kids, get your shoes on. We may need to drive down to the hospital, try not to alarm them, knowing that, we've already suffered the worst tragedy ever, where they were right there when little Vienna, fell asleep and didn't wake up.
Yeah.
Yeah.
That's just a hard topic in and of itself. So this on top of it.
Yeah.
We'll story first, and then we'll let you tell Vienna's.
I'm sorry, what was that first part? I'm sorry.
With Mike's story, and then we'll talk about Vienna.
Absolutely. Yeah. So it worked out, well, you know, to a certain point where, we at home, kind of getting things together. And then, but at this point, it was really interesting how, now he's turning up the oxygen even up to like 5 and 6 liters. I'm like, oh my gosh, yeah, this isn't good, And as we're driving down to Jersey Shore, and it's a 25-minute from where we live in Holmdel, and he's never been like this, where he's like, okay, how many more minutes? How many more minutes? I'm like, okay, 10 minutes ETA, just, and so he got there.
ER doctor who's
Yeah.
not to panic and is prone to helping other people without and keeping a calm demeanor.
Yeah.
So scary.
Yeah, it definitely was. But honestly, because I know that he's been posting a lot of things on Facebook, obviously, and his very entertaining ways and comical ways. I mean, honestly, that's kind of how
humor through all this. God bless him.
I mean, honestly, that's how we try to deal with horrible things, because especially after losing Vienna. I feel that there aren't too many things that could rattle us anymore, really, because of that, our situation with Vienna. But he got to the hospital, and really this is the scary part, is that, you have all these patients where, you drop off your loved one at the door. They take your temperature, they're out there with their full gear on, and he walks in, and that's one of the pictures I post on Facebook. Like, that was the last picture I took of him walking into, the ED waiting room. I couldn't even go in there with him. And I just felt really horrible. Like, I know I couldn't go in there, but just, you just feel empty and like, oh my gosh, like I can't do anything more right now,
But obviously you're FaceTiming with him every day. And so I know it was a few days still of struggling. That one picture I saw of him, it's like you're gasping for breath along with him, just looking at the photos. And yet he's making these jokes, but, just to try and lighten the mood, because it's so serious. But
yeah,
he went through a few days that were really tough. And I know even through those days, as the oxygen was coming down a little at a time that he needed, you were still saying that you've seen patients take a turn and you didn't want to get your hopes up. How is he today, and how has it been since he's been in the hospital?
Yeah, well, of course he's miserable, right? Miserable. But he got a report from him this morning. So, but he said he actually slept last night, and that's the thing. He usually doesn't sleep very well at all. It's hard to sleep in a hospital to begin with, and then with all the craziness where he'll he is kind of in a corner room where he can see various patients being rushed down the hall to get intubated. So and he knows what's going on, obviously. And but he said he actually slept last night, and he actually is breathing better. He's down to 6 liters on the high flow oxygen, so they want to slowly wean him down. And he said he was able to move around in the room a little bit better. He's sitting in the chair, which is good. So I know he's removing his oxygen sometimes to go use the bathroom, washing his face, that kind of thing, brushing his teeth. So that's definitely a positive thing.
And he can carry on a conversation with you now better than before. He was coughing so much, he couldn't have a conversation, right?
Exactly. Yeah, there was like a couple of days where he's like, like we spoke for minutes. Other days we didn't speak at all, because he's like, I if he starts to talk to me even a couple of words, there's no way he would be able to get out a full sentence. And then he would start coughing, and then the chest pain then would continue, and then even just trying to take a deep breath. And after you have surgery, you use this machine. It's called the incentive spirometer, where you breathe in air and you see how much your lung volume is. And so that's one of the things that we use to gauge how he was at home, right? So of course in the hospital they gave him one as well, but when you inspire so deeply, all those small little air passages in the alveoli are having a hard time opening up, so that actually then causes even more pain, and then a coughing spell. So it's kind of like a cycle. It's challenging.
Yeah. And then you have to try not to let the fear set in, and you're both doctors, so you know about all that. So we're going to keep praying for Dr. Mike. And if you go to our Facebook page, Instagram, Denise's, or our website, you can click on the story, you can click on Denise's links, and then you can from there get a link to Mike if you want to try and follow him. Everybody's prayer, the power of prayer is an important thing, but
yeah,
unfortunately this is not the first thing that you've been through. The reason we met was because of some dire circumstances, some grave circumstances. So if you don't mind sharing the story of Vienna, I know that you're doing things to help other people that have been in that kind of situation. So through her loss, you're helping more people. If that's what you can get from it, that's helpful. We want to thank you for doing that.
Yeah, thank you. Yeah, so for those who don't know the story, so our little girl, we have 3 kids, all starting with the name, the letter V. And Vienna's our youngest, and she was 2.8 years old when she died. This was November 12th, 2017. She was with our 2 other kids and our babysitter. My husband and I were on our way home from a wedding, and we get the frantic phone call that, you know, it looked like Vienna had fallen asleep watching TV. And then when our babysitter went over to go check her, to take her upstairs to go to sleep, you know, it was a little after 7 o'clock, 7:02, she was not breathing. And so that ensued just a whole cascade of events of just uncertainty. What is this? You know, and actually when we talked to the medical examiner the next day, you know, she talked about SUDC, sudden unexplained death in childhood, because she found nothing wrong with Vienna. She said, you know, you took really good care of her. You know, I found nothing wrong. You know, if everything comes back normal, all the cultures, pathology, everything, drug screen, you know, everything, it would be categorized as this sudden unexplained death in childhood. And even as physicians, we're looking at each other. We're actually at the funeral home, you know, looking at things we needed to take care of, and saying to each other, gosh, we've never heard of this. You know, we're 2 physicians and we're not out 40 years. Like, we're, you know.
And this is the same or related to SIDS with infants?
So good question. So SIDS are the babies that's less than 1 year old. And this is 1 to 18 years old. We're after a thorough investigation. And this goes for both SIDS and SUDC. So SIDS, birth to 1 year old, and then SUDC is 1 year old to 18 years old. So the definition is, the differences are the years, the age, but then you also have, you have to have an autopsy. So death scene investigation, including an autopsy, medical record review, and review of the clinical information, the medical history of the patient. So essentially it's like SIDS in the older population, you know, where in this case, we have no idea why these kids are dying. There are a couple, you know, thoughts, theories. You know, one big thing in the world of medicine is what's called, you know, I'll just touch on this briefly, but febrile seizures. This is something that in medicine we're taught are very benign entities, where if the little toddler has a rapid increase in the fever, they could have a seizure. Okay, it's supposed to be benign, not to worry about it. About 3% of the pediatric population have this in the world, but nothing to be concerned about, and that's what we're taught. Maybe a slight increase of epilepsy in the future, but really nothing to be concerned about. So Vienna had 4 of those. Very scary. Oh my gosh. And this goes back to how, you know, when you're a parent and a physician, I mean, we learn about these conditions in med school, and at that point, it's far away from you. Oh, okay, this is another, you know, disease process. When it happens to you and it's your own child, no matter what somebody says, many other physicians, oh, Denise, Mike, don't worry, it's benign. Yeah, but my kid is seizing, convulsing in front of me. How can you say this is benign?
Right.
You know, but one thing that recently a few studies came out where they're seeing that this number of percentage of kids with febrile seizures is actually way increased in SUDC kids. So it's a study of 3 to 91 kids, and about 30% of these kids had a history of febrile seizures, and then which is hugely increased from 3% to 30%. And then more recent, there's another study where they actually, this is, you know, a study where they actually looked at, you know, getting more into the scientific part of it, you know, 20 brains of kids. Vienna's was one of them, and she's in a research study, and how 12 of these 20 kids have a history of febrile seizures. So it's a small study, but that now brings up to 60%. Of course, a lot more research needs to be done. There's no, you know, public funding for this. So a lot of work needs to be done. That's why, you know, we started our family's nonprofit, Team Vienna, for SUDC awareness, to get the word out, because, you know, when you lose a child, it's you know, your world is turned upside down. And if we can do it.
You have, I mean, as a parent, it's unimaginable, but you have 2 other little baby kids that you now have to talk about this kind of thing with, that
Yeah.
you never would have to experience. And how do you explain it to your kids? It's heartbreaking. And from the moment this tragedy happened, you have had a community that has embraced Holmdel, Middletown. People throughout Monmouth County and now throughout the world have done everything that they can to give you love and support. And I know that you want to thank them, and then that you want to give us information so that any parent can know what to look for, where to go for more advice, or how to support you.
So yes, but yeah, thank you so much. The community has been absolutely amazing. And even, 2 years ago, right after Vienna died, we just moved to Holmdel, and we had a couple friends in the area, but not many, and so it was really amazing how, strangers, others who just kind of rose up and were there to help and really, did things for us that we didn't even know we needed. I mean, they didn't ask, they just did things. They just, helped in whatever way. And that's kind of happened again now. And with people now knowing us more because of Vienna and everything and being in the community. But our website is Team Vienna, SUDC.org. And so we're doing lots of different events. Obviously things are kind of held up now with the pandemic, of course. But one thing that we're still going to do, because people can still do it anywhere, and this is how we set it up a couple of years ago, is Vienna's Day of International SUDC Awareness, which is always a Saturday between Mother's Day and Memorial Day. So this year it's May 16th. We were going to join we are joining Mary's Place by the Seas race that day, but that may be postponed. But then we'll figure out what day they're going to do it then. But this is a day across the world where people are supporting us, supporting Team Vienna, supporting SUDC kids, not just Vienna, but all the kids, and remembering them, because this eludes the medical community. Physicians don't know about this, so if we can get the word out worldwide. Last year we had all 7 continents representing. It was absolutely unbelievable, wearing their Team Vienna shirt, taking a picture, they're walking, they're running. The whole point is being active, doing something for her, because she can't do it here anymore on Earth, and posting their picture on Facebook or Instagram. I'm getting more involved with that now. It's new to me. But it's incredible. So then people look that day and look at all these pictures coming up and really feel like a community of people who are fighting for the same thing on the same day in all different continents.
Yeah.
It's really remarkable. So we're doing whatever we can.
And, we wish you the best. You would never be able to nobody would want you to have to explain any more death to your kids. Your husband is such a fighter. And first of all, we want to thank him and every ER doctor and first responder out there for putting their lives on the line for the rest of us to keep us safe. And you have so many people praying for Mike. We're going to get him right here and do an interview with him when he's better. And
he would love that.
Going to get through this. It's so great to see your face. And to hear, you're a doctor and you can speak a mile a minute, but I know you do that a lot because you don't want to fall apart, and we don't want you to fall apart. But I know feel it in obviously I can feel it in your soul, that the pain you still carry around, and that'll never go away. But we love you. Yeah,
thank you so much. Yeah, and as it's been challenging with I had a really, really tough time over the weekend with Mike going in the hospital because knowing Vienna died, obviously we still don't have an explanation for that, and trying to explain death to our kids is just very, very challenging. And then my sister died of cancer, urothelial carcinoma, in November. So I have 2 close deaths in our family in 2 years, the same month. It's just and then now this, and like, oh my gosh, like, can we just stop the tragedies? And a friend of mine reminded me, I forgot, because everything's relative, right? I forgot we had an electrical fire where we lived last summer. I'm like, what the heck is
that? Was caught in time. Nobody was hurt.
I know.
And moving in and of itself is
I know.
Really, you've had enough bad. Let's joy going here and keep those prayers going. And again, it's sudden, unexplained death in children.
Childhood.
Childhood, yes, sorry. And you can go to 943thepoint.com, 943thepoint on Facebook. You can go to Instagram. You can follow Denise and get all of the contact information you need for what she's doing to help other parents. And we'll have you back. We'll check in again with you, okay?
Can I tell you one more thing for Mike? Okay, so I asked him, I said, what would be a message? I said, I'm doing this interview today. And so his message to everybody, well, of course, thank you for following, and thank you for also uplifting his spirits. And he really appreciates all the comments. He's trying to get through them when he can, when he actually feels the energy and the strength to look at everybody's comments, because that really, really means so much to him. It means a lot to me, to our family, that there's so many people, pulling for him all over the place. Even I know somebody in Pakistan, supporting, which is really incredible. So we really appreciate everything everybody is doing. Just want to make sure everybody knows that it really does mean a lot to us, and it's not, overshadowed. Like we definitely appreciate every single comment. And so his message is, his quote for today is, "I will rise up like the phoenix," is what Dr. Mike Superhero says. And I said, if he had a special song that he would want, you know, people to know him by right now, it's "Don't Stop Believing" by Journey. So we will not stop believing. We'll continue on. You know, he will continue to fight. We'll do our best to make this world a better place together. And actually, I was just telling a friend this morning, I'm so impressed by humanity right now. I mean, just in terms of people coming together, helping out, you know, helping other families who need help. I mean, you know, I just need to say just really quick, my med school classmate, you know, she's in North Jersey, and her mom, I'm sorry, her dad and her sister are on the vents right now. And actually, I just received a message from her yesterday that they are now looking for plasma donors for them. Wow. So yeah, so if anybody, you know, has recovered from COVID, you know, they're 2 weeks out, please feel free to message me. You know, Denise Wunderler on Facebook. I can send it on to her. I also, though, shared her post about her sister on Facebook. So she is very public about this now, trying to find a donor in New Jersey. So please, you know, help them if anybody can, because it's a very dire situation. So thank you so much for having me, Liz. I really appreciate talking to you, and thank you everybody who's here today.
All our love, and we'll talk soon, and we'll get Mike on because he's going to get better and come on here and do this.
Absolutely. Thanks so much, Liz. Thanks, everybody. Have a good day. Bye.
Bye.